This is Spotlight Omaha. Spotlight Omaha is a local podcast that highlights local businesses and influential movers and shakers in the Omaha business community. Spotlight Omaha is brought to you by Pixel Fire Marketing. Now, from the Pyramid Contractor Studios, the host of Spotlight Omaha, Jimmy Allen.
Good morning, everybody, and welcome inside the Spotlight Omaha podcast, where we take you around the city of Omaha, introduce you to local business owners, influential figures, and people who are making an impact in our community. We are brought to you by Pixel Fire Marketing. If your business isn't showing up at the top of Google searches, or maybe you need help with your search engine optimization, pixelfiremarketing.com is here to help. Check out pixelfiremarketing.com for more details. Joining us inside the Pyramid Contractor Studio today is Terra Soma with TiSoma Massage Clinic. Thanks for being here, Terra. Appreciate it.
Thank you for having me. This is a great honor.
It's pretty obvious what you guys do, but for anybody that maybe didn't read the title, what exactly is TiSoma Massage and what are you guys doing?
I'm a massage clinic as opposed to a massage spa, which is what you most commonly find in the city. The difference there being that a massage spa is going to do a lot to help you relax and helps blood circulation, perform Swedish massages, deep tissue massages. What sets me apart differently is that with clinical massage, people that come to seek me out are looking to fix muscle issues, pain that they live in every single day, a loss of range of motion in joints. They can't reach their back or they can't touch their toes, things like that. And they come into my clinic and find out that I can get them results. And on the first session, to increase that range of motion, reduce pain in the body, and massage has been proven to be able to get that for people.
Your spa is located in the front of the show's Young Chiropractic office over off Portal Road in La Vista. What are some of the benefits, or I guess the differences between chiropractic care and massage care for the things you just mentioned?
Chiropractic care targets more towards the joints. Chiropractic care is focused on realigning your joints and getting the proprioceptors in your joints to realize that they aren't properly aligned in your day-to-day movement.
Sure.
And that chiropractic adjustment feeds that information to your nervous system and allows your body to self-regulate.
Good.
And you've seen an adjustment before. You at least have an idea, and it seems to be like a very quick adjustment, and you hear that crack in the spine. My method is a little bit slower, and I'm targeting the soft tissues around those joints, and that's why it partners really well with chiropractic care. If they're realigning the joints and I'm getting the tissues around those joints to relax, then the body should be able to get that self-regulation and achieve harmony, lack of pain.
Is there a common misconception, because I think a lot of people think about massage as a relaxing event, maybe a pampering event type thing, versus actually needing it to medically benefit their body? And is that something that you guys are having to overcome pretty often?
Educating the public is something we have to overcome, and I never want to take a stance where I'm trying to diminish any sort of relaxation or Swedish massage at all. There is absolute validity to it. It helps.
There's both, right?
Yeah. It depends on what you're seeking, what your goals for massage are. Yeah. And so for people that are seeking something that's a little bit deeper in the tissues, harder pressure, and more getting your muscles to move if they haven't in a long time, then that would be more clinical work. And so I'm trying to help people understand that option is out there.
Obviously, when we talk about deep tissue massage, that's something that's probably needed, not necessarily a relaxing type thing. How difficult is it for you to, because listen, everybody's different, right? To find that medium pressure of what's good for this person is not good for that person, and how often does that change for somebody after they've been treated multiple times?
The sensitivity of the muscle can change almost stroke to stroke.
Wow. Okay.
Because if I do a nice, long, slow stroke and get releases out of your muscle, the sensation in your body will change immediately. It'll be less intense. It'll be more pleasurable. As far as finding that person to person, there's a level of art to the work that I do.
And you've been doing this for a while. So.
Yeah, about 4 years. Yeah. And I work every single day, over 1,000 hours every year. I don't know how to explain it, but when you feel a muscle, everything you need to know is usually in that touch. The density of it, the hardness of it, how much it's pushing back at you. And you use that information to lay into the muscle and know exactly how hard to push.
What's the most common request you get from a complaint standpoint? Hey, I'm coming to see you because...
Hips and shoulders, sciatica, and thoracic outlet syndrome, which is kind of a doctor's way of saying your shoulders kind of hurt, and it's not quite carpal tunnel, but it's kind of getting there. So things like that, and I help people to get that tingling or numbness when they sleep on their shoulder to go away.
Is it fair to say most of your patients then are people that sit at a desk most days?
That just happens to be the commonality of American lifestyle. Yeah,
Sure,
most
good
people
point.
work in office jobs, drivers, people who work a lot of driving. We have Amazon here in the city,
Right.
so of course a lot of Amazon delivery drivers, and that kind of driving 8 hours a day, however long their shifts are, really has an impact on your hips as you're sitting on a shaking car.
Right.
And the muscles in your low back, your quadratus lumborum, QL for short, has to kind of act as a support system for that as you're rattling around.
If somebody wants to book a massage with you, what does that process kind of look like?
They can go to my website is just a booking page through clinicsense.com.
Sure.
They can either Google for my business name. It'll come up if you look at it, and there is a QR code on the back of any information I have that'll take you straight to the booking page.
When we talk about common themes and people that get massage done, what are some of the benefits long term of clients that have seen you multiple times?
One more time?
Yeah, so like if somebody comes in, they come in and let's say there's 5 people. What are the common themes among those people after they've had massage clinic? What are they telling you is better?
Yeah, their limbs feel lighter. They have higher range of motion immediately and less intensity in the pain in those areas. And with this type of work, this deeper level of work, you can expect a little bit of soreness that feels like a workout in muscles you haven't worked out in a while.
Sure.
The following morning, maybe following into the second day, but after that, they're going to feel incredible, lighter than they've felt in years and more mobile.
If somebody's coming in for a massage for the first time, what piece of advice do you give to that person for like beforehand?
To cater their goals. This takes a while. When I work massage, I usually work one focus area of the body. So I'll do just your shoulders for the whole hour because that's how long it takes to, one, make it not hurt,
Right.
and 2, to get those results. And so if the person comes in, they have an expectation that I'm going to hit their whole body in the hour. I'm going to fix them in one session. These are unrealistic expectations. So if they're coming in pain, then they need to know that they need to get massages more frequently towards the beginning of their visits. And once that pain subsides and they're symptom free between sessions, then they can stretch out their sessions. I typically recommend 4 to 5 weeks if someone's on a routine maintenance cycle.
There seems to be a rise in like dry needling or acupuncture and things of that nature. Do you guys offer anything like that, or is it strictly massage?
For me personally, I stick to classical massage with just my forearms and elbows. Hot stones I'm starting to offer starting this week.
Why?
Because the way you affect muscles is stress. The force that I'm applying to your muscle is stress. Heat is another level of stress. And heat affects your body by dilating your veins and increasing blood flow. And by doing the technique that I have with a hot stone, I'm able to get those results for people a lot faster.
Okay. And I cut you off. What else are you guys offering? Sorry. You said hot stones.
Yeah, me personally, yes, hot stones. I use hot towels in my practice. It's not really something I offer. And then cupping is something I also offer. Right now, I'm not selling it as its own service.
Complimentary type thing.
It's something I can add to the service. Say it takes me a whole hour just to work your shoulders, but your hips do also hurt. I can take 5-10 minutes, put the cups on your hips, and that'll affect that area while I spend my whole focus on the upper shoulders. And the only thing that you're paying for, so to speak, is the time it takes away from the massage.
For anybody that may not know what cupping is, can you kind of give us an insight to how that's helping and what you guys do?
Yeah, cupping is another way to stress out the muscles where normally I'm trying to push my elbow through the muscle, trying to push into it. Cupping it's a traditional Chinese style of medicine where you apply these cups to the person's body and you have a suction.
Yeah.
So it sucks your skin and your muscles up into the cup and you leave it there for about 10-ish minutes. And it increases blood flow drastically to the area. And just like
that'll cure a lot of things on its own right? Just the extra blood flow?
Yeah, the main thing with the massage is massage therapists aren't healing you. They aren't magically doing the healing to you.
You don't have a wand?
No, we're facilitating and speeding up your body's natural healing process with the stress that we're applying.
And you're taking away the medicine aspect of it too, right? And I think that's a big deal for a lot of chiropractic and massage clinics that, hey, we're not going to prescribe you anything when you walk out of here.
Yeah, I'm not a doctor. I can't diagnose. I can't prescribe.
Is that a big deal for you, though, to help people without giving medicines?
Yeah, a lot of people who come to me are looking for surgery alternatives, and I feel like I'm getting a lot of them pain relief that they're searching for.
Sure.
Yeah.
We're catching up with Terra Soma of TiSoma Massage Clinic here on the Spotlight Omaha podcast, brought to you by Pixel Fire Marketing and Pyramid Contractors. You guys highlight athletes on your Facebook and your website page as well. But I'm not looking for like a pie chart here or anything, but like if we talk about athletes versus your standard maybe 30 to 40-year-old, what does that look like for you from a balance standpoint of how much you guys are doing? Or is that something you'd like to increase? Maybe more athletes?
I would like more athletes to understand that I am out there and I'm doing the work I'm doing. My clinic's only been open since March of last year.
Right.
So a lot of this is just trying to get people aware that I exist.
Should do more podcasts.
I think so. If the people that do sports know that I'm around, they can find someone that can actually fix their muscles, which there are plenty of sports massage therapists in the city. I'm not the only answer, but I'd like to know.
Pretty good one, though.
Thank you. Thank you very much. I'd like the people at Papillion La Vista know specifically that, I am here for you. Like, I'm fixing problems.
Papillion Landing right up the street from you guys. You guys got both the high schools right there, too. It'd be
new pickleball and basketball court there on Portal Road.
Yep, AEF, if you're listening, and we'd love to introduce you to a good massage clinic. What does growth look like over the next 2 to 3 years for you personally?
Right now, I'm trying to just build awareness. Once there's people just struggling to get on my schedule, then I know it's time that I'll need another massage therapist working with me. I'm going to look for a location, hopefully in the same area. I know that strip mall is pretty long that Dr. Young and I are in. And hopefully I can get one of those spots.
Start people in the bay next to him to move out. Problem solved.
Feral Body Works. Yeah. They're really good for shadow boxing.
I'm sure.
Yeah, and great.
Probably some people in there need a massage or two too. Not a bad spot to be in.
Yeah. But if I achieve that level of awareness and people are trying to get in the door, then I can hire another massage therapist and train them up to be clinical like I do.
Sure. Is that like when I think this is one of the most intriguing questions we ask because it's so different for everybody. A lot of people want to open something and sell it off as a franchise later, maybe open up a franchise model. Is the ultimate goal for you to hire and train and step away, or do you want to always be involved in the practice?
Probably step away in the long-term goals. Yeah.
Because?
I'd like to retire to the Netherlands specifically. Yeah, I have long-term goals to move over to Europe.
That's interesting because you spent some time in the military. You're a former Air Force. What in the Air Force trained you, other than like just obviously learning how to move muscles and stuff for this line of work?
The leadership aspect would be the most direct training I can translate from my military training to here. But as far as working muscles and the medical aspect of what I do, that's a part of my training, which thankfully I got because of my GI Bill.
Sure.
Joining the Air Force in my 20s was the best thing I could have done with my 20s.
You're originally from Florida.
I am.
The Air Force brought you here, correct?
Yes.
What is the big, other than it's cold and it snows here? Well, I guess that's not unique to Florida anymore. But what is the biggest difference between the 20 years you spent in Florida versus moving up here and obviously being a part of the military? What's different about Omaha to kind of the east side of Florida?
I can't really compare a Midwestern city to a tropical city.
Sure.
The architecture is different. It feels like you're on the beach. Your annual terror season of hurricanes is something you can kind of set your clock to.
Sure.
So people ask me like, "Oh, do you miss hurricanes?" Or like, "Was it ever a big deal?" It's like, no, you
knew it was coming.
You knew it was coming. Your house is built to withstand it, or you have a plan.
Right.
Yeah.
We talk about doing business in Omaha. What's something that you've learned about doing business in the Midwest over the last handful of months that you guys have opened that maybe you didn't know when you first opened the door? If anything, the answer would be nothing.
No, yeah, I'm moving steadily. I learn every day, but I've been keeping an open mind to this ever since I was in school, and I graduated here from Omaha School of Massage, and I've just kept my ear to the ground as far as how the industry is moving and how a spa/clinic massage clinic functions and what it needs to function.
One thing that keeps coming up in this room that blows my mind almost every single day is it doesn't matter if it's roofing or selling or whatever it is. Everybody in Omaha seems to believe that there's enough work out there for everybody, and they have people within the same industry that they bounce things off of. Is that the same in massage?
Yeah, I'd say so.
Okay.
Yeah, you need that kind of healthy.
Is that surprising to you?
No.
Okay.
No, we're a healing industry, so like there is no room for hostility
But it's business. You hear how cutthroat business is, and it's just incredible to me that it just seems like it doesn't seem to matter what the industry, people that are quote competitors are often helping each other.
I think some of that comes back to the intent and technique of the practitioner, the massage therapist. Like people that are coming to me are coming for a specific hard-hitting massage.
Sure.
If they want a relaxing massage, I am not the person to go to.
Do you turn those people away? For lack of a better term,
I make sure that if they're going to stay for the session, they have an idea of what they're getting into. Okay. Yes, I can move towards a relaxing massage, but I still am more aggressive in my technique just by natural. I'm a martial artist. I am healthy. I work on myself. So I work on myself pretty aggressively. I have a healthy body, and that's just kind of set my normal.
For somebody that's not expecting that, is that something they're open to hearing, I guess?
Sometimes there's a few people that have gotten deep tissue massage sometime in the past, and they walked away feeling like, oh, that person just like really beat me up. I don't
Sure.
think that was pleasant at all.
Yeah.
And so I have to kind of help them assuage that fear and
So
be like,
the education comes back in, right?
right. Yeah. And I'm like, hey, they were probably. I don't know the situation they were in, but they were probably trying to fit a lot into an hour because of the working conditions they're in, especially if you're on like a cruise or some situation like that where massage therapists get worked pretty hard. The technique I use is very well crafted and curated, so that pain level should always be manageable. Your body should never be screaming at you during a massage and burning, stinging, biting. Like,
Sure.
That's not.
We often hear people in the medical field of all walks of life talk about hydration, right? How much does being properly hydrated help with a deep tissue massage?
It helps entirely. Your body needs water to create blood and needs water to move that blood around your body, and that's how it heals. It gets the nutrients and the oxygen to the muscles, gets the waste out, so you have to stay lubricated. You got to stay hydrated.
I asked Dr. Derek this question because there seems to be some people out there that don't believe in chiropractic care. I've been getting adjusted for the better part of 6 years. If you don't believe in chiropractic care, you're wrong.
Agreed.
Is there anything... is there a certain stigma or maybe a hurdle that masseuse or massage therapists have to overcome as far as misconceptions about the industry?
Mostly going back to the fact that it's all just for relaxing and pampering fancy ladies on their day off,
Yeah,
or
sure.
like going to the mall and just having a nice day off.
Right.
Like, massage is and has been for thousands of years a way to fix muscle structure, like problems in the body and pain, and working in that realm of massage. Whereas the relaxation, again, perfectly legitimate. Like, there's
Just two different things.
yeah, it's your goals.
Yeah.
So if you're trying to relax, that is important. Today's a very stressful life for Americans every day. So a relaxing massage might be great.
Yeah.
And for people who don't have a lot of people don't have a lot of contact, it's just a nice real way to just get your muscles worked in a quiet setting, turn off all the noise we have to deal with every day. Sure. Yeah.
Put these things away. When somebody comes in for the first time and maybe it's their muscles are in a little rougher shape than they had thought, you walk them through the education portion. How often are you telling people to come back? What does that process look like?
It depends on their goals. If I'm pushing into their muscles and they're feeling high intensity and things are tight, then they're going to need more sessions more frequently towards the beginning of their visits. And that way we're going to try and force a really hard reset on the muscles during that time. And then you'll start to see lasting results from that work.
Walk us through the process. If somebody wants to come in and get a massage, is there a consultation beforehand? What does that look like when they walk through the door?
Every massage is sold in its time period. So let's say an hour is a good average. When I bring person back, the first 5 minutes of that is going to be the consultation.
Sure.
If it's your first session, that consultation might be a little bit longer as the education needs to be a little bit more explained.
This is what hurts and why type thing.
Yeah, but as people are more regular, and I rely on my notes. I'm a clinic with a results-based business, so I got to take notes, and I'm keeping track of all of my patients and how they're
Which I think
working.
everybody would appreciate that's coming in for those reasons.
Yeah, because I see like 30 people a week, so it's hard to keep everything straight. I wouldn't be able to make sure I knew who you were.
Sorry, go ahead.
Yeah. And after the first few sessions, and I know who you are, then even the consultation time just gets down to like let you in the room, check in with you, make sure that we're hitting the same spots that we've agreed upon beforehand. I'll leave to wash my hands, give you a chance, and then any time not spent on that consultation is given back into the session.
We're catching up with Terra Soma of TiSoma Massage Clinic here on the Spotlight Omaha podcast, brought to you by Pixel Fire Marketing and Pyramid Contractors. I think oftentimes maybe we misjudge our body and maybe don't understand what we need at times, which is why we're probably coming to a medical professional in the first place. How often are you... Because I think a lot of people, when they're going somewhere for the first time, they always go shorter than probably needed because they may be a little skeptical. Yeah. If you're in there and you're working on somebody and it's a little bit rougher than you thought, or maybe they need a little bit more than they originally, what does that conversation sound like, and how often is that happening?
If I have the time for it, I'll suggest that I could use more time to work on this problem, because when I start working on someone, they can feel the difference immediately. The way I'm pressing into them, the way their muscles are changing, and they can feel that I am working on them. I need more time, and it's not me being like, "Hey, I'm selling you more time because I want more money," or anything like nefarious like that. Yeah. My sessions, I'd say typically 90 minutes is a good average, especially if you're starting out. It takes a while to get through the body, especially if you have more than one focus area. And
what are the different time frames that you offer? Because it starts at a half hour.
yeah, half
How long
hour,
can you go?
45 minutes, 60 minutes, 75, 90, and then 2 hours.
Okay.
If anyone has any ideas of me ever reaching a full body massage, 2 hours is as close as I'm going to get.
Sure.
If I start finding problems to fix in the body, 2 hours, even that might not even be enough time.
We'll see in a week.
But 90 minutes is the ideal time frame, to go back to your last question, and the price points in my business are incentivized to note that.
Yeah.
It's your best bang for your buck is the 90-minute session.
Can you give us the prices and how they break down?
Yeah, it's $90 for an hour, and that includes tax, and I don't accept tips.
Oh, okay.
Yeah.
Because?
I consider what I do to be a form of medicine. It's some sort of health, and it's not a luxury service.
Yeah.
So for that, you don't tip medical professionals. Yeah. And I feel like if I'm going to take myself seriously as a clinic that's fixing issues and doing something health related,
Big deal for you?
It is.
Why?
Because I always knew that massage could be something else. I've gotten massages throughout my life, and a lot of times I left feeling, wow, that was really nice, but something was missing, or I feel like something could have been changed to make it work. And I've heard that from a few of my patients. They're like, I feel like something could be a little bit more on point with this, but there's an idea here.
I don't want your answer to this to sound like you're throwing shade at anybody or cheapening it, but does the tip process seem like it almost cheapens what you do a little bit? Because you've spent a lot of time doing this. You mentioned graduated from the school of massage, and then
again, I'd say it goes back to the intent.
Sure.
I consider myself a clinic, and I'm going to stand on that. But if someone's giving a luxury service, then that tipping is generally a part of that environment.
It's two different things, right?
I don't have anything wrong with other people trying to run the business the way they want to run it.
You guys are in La Vista. We pointed out where you guys are. What's the reception from the community been like since you opened your doors?
They're really glad to have me. Since I'm newer, my schedule's not completely full, even though it's getting pretty full.
Congratulations.
Thank you so much. So people are grateful to have me, and they're able to get into my clinic within about 48 hours, 72 hours at the most.
We're getting that point in the day where we tend to shut her down. Is there anything we haven't mentioned about TiSoma massage that we haven't hit on yet?
Nothing that I can think of right now, other than my massage is very curated to individuals as I work with them. So there really isn't a person that my massage style is wrong for. But again, I'm not your ideal relaxing massage. There's people that are way better than that, than me at that.
Over 26 5-star reviews on Google. You can get a hold of them at 402-302-0975 to book with Terra and his team. Thank you very much for doing this. I appreciate it.
Thank you.
This has been the Spotlight Omaha podcast brought to you by Pixel Fire Marketing and Pyramid Contractors. We have a two for today. We have another interview coming up. John Ewing, who's running for mayor, is going to join us later today to discuss why you should vote for him, his campaign. We're also going to do a 3-part series with all of the candidates running for mayor as well. We hope you enjoyed Spotlight Omaha podcast. Stick around for John's interview today. Terry, again, thank you for joining us.
Thank you for having me.
We'll be back in a little bit. Thanks for joining us here on the Spotlight Omaha podcast brought to you by Pixel Fire Marketing, Pyramid Contractors.